All right, with us now, two CNN political commentators, David Urban and Bakari Sellers. And David, I want to start with you. I do a morning show from time to time, and we came in this morning and we were convinced that there was going to be a health care plan of some sort or proposal announced today. Why? Because there was a serious float, because the White House floated that it was likely to come. It was in Axios, it was in Politico, it was in Punchbowl. We, of course, were told whispers of it. We were even given some of the details about it. But then, late today, nope, nothing. So what happened? The float didn't go so well?
Hey, John, you've seen that. I think it's about that time for that Charlie Brown Thanksgiving special to be replayed, perhaps, right, where the ball gets yanked away. Look, the healthcare is incredibly complex, and this is a plan that's going to require buy-in from tons and tons of Republicans up and down the ticket in the House and in the Senate. Lots of folks are going to have to stand for reelection in the midterms. And what this plan looks like is going to be very consequential to them. And so I think that when whispers of the plan got out there, as you say, members of the House, members of the Senate said, hey, we want to hear some more details before this gets rolled out, because we're going to have to pass it. We're going to have to implement it. We're going to have to do a lot of these things. I think most members of the House who are Republicans and Senate would like to see the cost curve get bent. I don't think anybody realistically thinks they can chuck Obamacare, but it sure needs to be fixed, because since it's been signed into law, healthcare has not gotten any cheaper. It's gotten more and more and more expensive, and costs have kept going up. So something has to be done. We just can't keep throwing money at it.
What made Republicans nervous, though? Because it was a 2-year extension of the Obamacare subsidies. It was an income cap, maybe at 700% of the poverty level for recipients, and a requirement of some kind of premium payment. Someone balked on the Republican side, David?
Yeah, I mean, presumably, John, right? Presumably more Republicans may say, look, we want deeper cuts. We want money to go certain places. There are 435 members, right? Each one of those, it's like counting, hamsters in a cage. You think everybody doesn't have an opinion on this, John? There are a lot of tough races coming up. A lot of members are going to be on the bubble, especially on this issue. And I think that they want to have some buy-in, have some say before they have to walk a plank on something.
Bakari, there were Democrats who were saying of this plan when the contours were being leaked this morning, maybe it doesn't sound so bad. I mean, what does it tell you that the White House was there maybe earlier and now not there later?
It tells me that those Democrats probably have an election and a tough seat. There's nobody who believes that Republicans know how to fix health care in this country. What Barack Obama did with the Affordable Care Act, we call it Obamacare affectionately, was make sure that he expanded health care coverage for millions of Americans. Whether or not you were going up to 26 years old, whether or not we were expanding Medicaid in different states, whether or not we were eliminating the ability for insurance companies, and David probably remembers this, but insurance companies could kick you off or not cover you because of pre-existing conditions. And Barack Obama eliminated all of that. Does it need tweaks? Does it need help? Does it need work? Yeah. But we've realized a long time ago, ever since John McCain did the infamous thumbs down, that Republicans don't know how to fix health care. That is a fact. They've been running on repeal and replace Obamacare for how long? I mean, my kids weren't born. My kids weren't born. They'll be celebrating their 7th birthday in January. My kids weren't born when Republicans started talking about repeal and replace. I mean, that's how laughable it is. Does Obamacare need to be fixed? Yes. Does it need to be updated? Yes. Does it need to grow with the times? Of course. But one of the things you can't do, John and David, is you can't pass the one big beautiful bill and eliminate the subsidies and then say, oh my God, the healthcare costs are rising. This is why a lot of people had trouble with the government shutdown. This is why when you look at this in with 50,000-foot lenses, you recognize that the Republicans now own this because they're the reason that the costs are actually spiking.
Well, no plan today. I mean, we know. Hang on, Dave. Hang on.
Yeah.
I just want to shift this a little bit because we didn't get the announcement of a plan today. Clearly, the White House thinks or thought that they needed to be in this space, although they backed off. Then late today, we have these Comey and Letitia James decisions, and now we're hearing a whole lot of noise there. What do you think voters see, right? If they want people to address health care, if they want people to address affordability, but instead what they hear is Comey and Letitia James, is that where they want the focus?
No, listen, I don't think that's where they want to focus at all. And just to correct the thing that Bakari said, Republicans didn't do anything in the one big beautiful bill. The Obamacare subsidies sunset when during the pandemic, when Democrats passed this, they knew they were going to expire. They knew they were going to sunset. So Republicans didn't pull the plug on anything. They just didn't renew it. Listen, John, clearly the president got the affordability message. He had a very nice powwow with the mayor-elect of New York. I think many House members who are running in tough seats and many senators who are up. Everybody in America, they're hearing it, right? So the administration, this current administration, is doing a very good job. Inflation is getting under control. Real wages are catching up. But there was a big deficit for the past 4 years of the Biden administration they left us with. 10 months of the Trump administration, right? Those lines are getting closer, right? Real wage increase and inflation are getting closer, but there's still a deficit. People still feel it in their pocketbooks. And that's the thing that the government writ large, House, Senate, Democrats, Republicans, that's what they should be doing. That's what they're elected to do, to make people's lives better.
David Urban, Bakari Sellers, happy Thanksgiving week to both of you, my friends.